We, though, are going to begin with the COVID-19 situation in South Korea. Health authorities now saying the healthcare system in the capital region is officially in the danger zone. Trying to do what they can, officials are looking to expand booster shots and make changes to vaccine pass rules.
To fill us in with more details, we have our reporter Kim Yeon-sung in the studio with us. Good morning, Yeon-sung.
Good morning.
So Yeon-sung, like Mark just mentioned, health authorities say the capital region's medical sector has reached the highest threat level. What does this actually mean?
Right, so let me take you back to last week to really give you a full picture of what this all means. So last week, when the capital region's ICU beds first reached 75% capacity, and there were more than 500 critically ill patients nationwide, a lot of people had started to wonder, does this mean an end to gradual easing of COVID-19 restrictions? And you know, health authorities had been forewarning that they were going to pull the plugs on the easing of the measures if the healthcare sector looked like it was becoming overwhelmed. And at the time, data appeared to show that the situation was quickly heading towards its breaking point. But authorities at the time have continued to reassure people that everything was still under control and that we can still move forward with the gradual easing of measures. And as a way to give further peace of mind, authorities announced last week some of the specific criteria they were going to take into account if they went and go ahead and made changes to the easing of measures strategy. They said they were going to look at 17 indices, including the number of ICU beds filled and the basic reproductive number of the virus, and assess on a weekly basis where the country stands in terms of a virus threat. They're going to use a scale of 1 to 5, with 1 being very low level of danger and 5 being very high. And during the announcement on Monday morning, which was actually just yesterday, they reported the capital region's danger threat level to be standing at a very high threat, while the nationwide threat level was just at a high.
Right, but not so long ago, we were reporting, perhaps it was even you in the studio telling us, or one of our other correspondents, that the capital was still at the moderate level and the rest of the country was at low. So what's happened in the meantime? Right,
so health authorities are rather concerned about the ICU beds filling up at an alarmingly rapid rate. So as of Monday, more than 83% of the ICU beds in the capital region had been filled, while more than 900 people were waiting for their beds. And then there's the issue of rising infections as well.
So are authorities making any changes to, calm down the situation?
No, not as of yet. But why don't we take a listen to something that came up in the briefing last night?
Infections in the capital area have continued to rise and saw an average of 2,174 cases in the past week. That's a 27% rise from the week before and a record high.
Right, so as of Monday, 9 p.m., health authorities logged 2,344 new infection cases nationwide as well.
And tell us what else we should be paying attention to, Yeon-sung.
Exactly. So authorities are really trying to ramp up the booster shot campaign in a way to tame the current situation. Commissioner Jung from KDCPA said on Monday afternoon that people aged 18 to 49 may also need their boosters, and the booster rollout for the younger age groups may start sometime next year. She also added that authorities may look into setting an expiration date for the vaccine passes and only allowed it for people who've had their latest shot within several months. Authorities are also recommending that teenagers and children get their jabs and are looking into expanding vaccine passes to places where students often visit after school. Prime Minister Kim Boo-kyum also chimed in on the matter Monday afternoon and said that they're working to secure more ICU beds and speed up the booster rollout.
It just seems to be getting more and more dire by the day, unfortunately, but at least you'll be back with us in the studio next Monday, I believe, to brighten up our morning, Yeon-sung. So we look forward to that. Thank you for coming in again.